You know that feeling, right? That confusing, nagging pain somewhere in your middle. What is your body actually trying to tell you? Well, in this explainer, we're going to decode those signals. We're going to map out the abdomen, just like a doctor would.
It's got to be one of the most common things we say, my stomach hurts. But the abdomen is a big place. It's packed with all sorts of vital organs. Just saying my stomach hurts is kind of like saying my car is making a weird noise. To figure out what's really going on, we have to get way more specific.
So here's our game plan. We'll start with that vague stomach ache itself. Then we'll dive into the map doctors use to navigate the abdomen. After that, we'll see which organs are in each zone, connect specific pains to potential problems, and finish up with some really crucial final clues.
All right, let's start with the problem we're all familiar with, that vague, kind of non-specific stomachache, the one that could mean just about anything or maybe nothing at all.
So here's the secret. Doctors don't just guess. They have a system. Think of it like a mental GPS for your abdomen that helps them pinpoint the location and narrow down all the possibilities. So let's take a look at the map they use.
So how do we get more specific? Well, we use what we're calling the abdomen's map. This is the simple grid system that turns a big, confusing area into a really easy-to-understand chart.
And here it is. Seriously, just think of your abdomen as a tic-tac-toe board. You've got 3 rows. The top one is your upper right, upper middle, and upper left. Then the middle row has the right side, the central spot around your belly button, and the left side. And finally, the bottom row has the lower right, lower middle, and lower left. Each of these 9 zones has its own medical name, as you can see right here.
Okay, so knowing the zones is step 1. Now, let's peel back that layer and see which organs actually live inside each of these little neighborhoods.
This is why the map is so incredibly useful. You can see right away that the upper right section, that's home to the liver and gallbladder. The upper middle is stomach and pancreas territory. And way down in that bottom right zone, that's where you'll find the appendix. Every zone has its key residence, which makes the location of your pain a huge clue. Okay, this is where it all comes together. Let's start connecting the dots and see what pain in a specific area might actually be telling us. Let's start with that upper right corner, right under your rib cage. If you're feeling a sharp or even a dull ache here, your doctor's mind is immediately going to a couple of key players. Since this is basically liver and gallbladder country, pain here could point to something like hepatitis, which is an inflammation of the liver, or pretty commonly, gallbladder issues. For example, if gallstones are blocking the little ducts leading out of the gallbladder, it can cause some really intense pressure and pain right in this spot. Now let's just shift over to the center, right in that upper middle zone called the epigastric region. This is a spot that a lot of people think of when they say they have a classic stomach ache. Well, this area is home to the stomach and the pancreas. So that awful burning feeling you get from bad acid reflux, it often hits right here. It could also signal things like gastritis, peptic ulcers, or something more serious like pancreatitis, which is an inflammation of the pancreas. All right, let's jump all the way down to the lower right section. This is probably the most famous neighborhood in the entire abdomen, and for one very specific reason. You probably guessed it. Appendicitis. A sharp, focused pain right here is the classic sign, but it's not the only possibility. It could also be related to colitis, which is an infection of the colon, or, in females, an issue like an ovarian cyst. So the location is definitely the biggest clue, but it's not the only one. There are a couple of other crucial details that can help solve the mystery of what's going on. Here's a really important distinction. Is the pain in the front or the back? See, pain that you feel mostly in the front usually has to do with the digestive system. But if that pain wraps around or radiates to your back, on either side of your spine, that is a huge clue that it might be your kidneys, maybe from a kidney stone or an infection. But what about when the pain isn't in one neat little box? What if it just feels like it's, well, all over the place? This is what doctors call diffuse abdominal pain, and it often points to a problem that's affecting the whole system. One of the most common causes, believe it or not, is simple trapped gas. As that gas moves through your intestines, it can cause sharp, shifting pains that just don't stay in one spot. Okay, now this is without a doubt the most important point of this entire explainer. This map is a tool for understanding your body, not for self-diagnosing. It's meant to help you talk to your doctor more clearly, but it is absolutely not a replacement for professional medical advice. If you are in pain, you have to see a doctor. So now you have the framework.
The next time you feel that ache, you won't just think, my stomach hurts, you'll have a map to ask yourself, where exactly? Now that you know the map of your own abdomen, what are you going to listen for?